Welcome to the Center for Reproductive Medicine's ovulation induction, also known as getting pregnant using daily injectable medication. Call with the onset of your period. First aid, full flow, heavy enough to use a pad or a tampon. We don't count spotting or light flow. Consult your nurse if you have irregular cycles. Call during regular business hours, Monday through Friday, 8 to 4 p.m., and leave a message on the nurse voicemail. If you start on the weekend, don't panic. Just leave a message. We'll return your call on Monday. We never do any of our testing on day one. Make sure that you call us with the first day of your period, full flow, heavy enough to use a pad or a tampon. Your nurse will schedule you to come in for your ultrasound and labs on day 2, 3, or 4. Make sure that you don't wear any perfumes or colognes out of respect to the other patients and our staff. Make sure that you set up your voicemail to receive instructions in the event that you can't get to your phone in time. Your medications will be called into a mail order pharmacy. We'll give you the phone number to call that pharmacy. It's always good to understand your insurance benefits. You'll need to contact the mail order pharmacy and pay them for your medications. Have those medications delivered to your home. CRM can't be responsible for your medications if they're delivered to our offices. Cycle management. Your first ultrasound is always called your baseline ultrasound and blood work. You'll come in day 2, 3, or 4 to get your ultrasound and labs. You'll receive a call late in the same day that you came in for that ultrasound with instructions. Please don't mix or take any of the medications unless instructed by your nurse. You usually will start your medications the day of your baseline. We don't perform any baselines as a general rule on the weekends. 2:30 is the latest that we can perform an ultrasound and labs, as long as we have staff available to do that. The physicians will not allow any patients to take medications without being monitored. This is a graph showing the first phase of your medication. This is either going to be Follistim or Gonal for most people. The main thing is that you call us with the first day of your period, full flow, heavy enough to use a pad or a tampon. If it starts on the weekend, remember, don't panic. Just leave us a message and we'll call you on Monday, but be prepared to come in on either Monday or Tuesday. When you come in, that's your baseline ultrasound. You'll receive a call the same day to start your Follistim or your Gonal. Your follicles should be small and your lining should be very thin on day 2, 3, or 4. Then what will happen is the nurse will call you back the same day with instructions once the physician has had a chance to review your cycle. They'll give us instructions on how much medication to take, when to take it, and when to come back. Your nurse will make those appointments for you. Generally, the first ultrasound after the beginning of drugs is usually 3 to 4 days from the start of your medication. So let's just pretend that you started on Wednesday, you'll come in on Friday. The nurse will call you back that afternoon and tell you to take how much medication for Friday night, Saturday night, Sunday night, Monday night, and the fact that you'll come in on Tuesday. The nurse will then make your appointment for that lab and ultrasound. Stimulation days can be as few as 6 days or as many as 23. It really doesn't matter. What matters is that your follicles are growing and that your estradiol level is within a reasonable medical range. What we're looking for is the target follicle size for mature follicles is considered to be 18 to 21. As again, it may take as few as 6 days, it may take as many as 23 days. You'll have scans intermittent at this time. What does FSH really do? This is the first drug that's given in any stimulation cycle. Follistim or Gonal are both FSHs. They stimulate the follicle growth. You'll take this every evening around the same time until your follicles are mature. Remember, that's 18 to 21 millimeters. It can take as few as 5 days or as many as 23 days. Your body will be the determining factor of your stimulation cycle. Follistim Gonal. Take your injections around the same time every day within a 2-hour time frame. It doesn't have to be exact. What you want to make sure is if you take it at 7 o'clock every night and then you're out until about 9:30, that's okay. Just go ahead and take your dose, but try to get back on track. If you forget a dose, don't panic. Take the dose as soon as you remember it and continue until you're supposed to come back. Call your nurse if you want to follow up with her during regular business hours, Monday through Friday, 8 to 4 p.m. Gonal F has the following products for your convenience. Gonal F RFF Ready Jet Pens that are available in 3, 6, and 900 IU. The Gonal F Multidose 450 IU and the Gonal F 75 IU individual vials.
Hold the pen with one hand and pull off the pen cap with your other hand. Put the pen cap aside. You will place it back on the pen later. Check the reservoir in the pen. There should be no cracks in the plastic window, and there should be liquid in the reservoir. The liquid should be clear and colorless with no particles. Get another pen if there are cracks in the reservoir, there is liquid, or the liquid is not clear and colorless. Check the dose display in the pen. If there is any number other than 0 on the dose display, set the dose display to 0. To set the dose display, turn the dose knob in a counterclockwise direction until you see 0. Step 2. Attaching the needle to the pen. Pick up the new needle. Remove the peel-off seal from the outer needle cap. Hold the outer needle cap in one hand and the pen in your other hand. Place the needle on the end of the pen where you see threads. Using some slight pressure, screw the needle onto the pen in a counterclockwise direction until you cannot turn the needle anymore. Gently remove the outer needle cap and place on the table to use later. Leave the blue inner needle shield on the needle. Step 3. Removing large air bubbles from the pen. Small air bubbles in the pen's reservoir do not need to be removed from the pen, but large air bubbles in the pen's reservoir must be removed. A large air bubble is a bubble that appears all the way across the top of the reservoir. If you do not see a large air bubble, go to Step 4 to select the correct dose of Gonal F RFF ReadyJect. If you see a large air bubble, turn the dose knob in a clockwise direction until the dose display reads 25, meaning 25 IU. Only use 25 IU to remove air bubbles. With the needle pointing up, tap the reservoir with your finger to allow any large air bubbles to rise to the top. Carefully remove the blue inner needle shield and throw it away. Do not recap the needle with the blue inner needle shield. Holding the needle pointing up, slowly press the dose knob as far as it will go. Release the dose knob. Find the outer needle cap and place on a flat surface. Holding the pen in one hand, slip the needle into the outer needle cap without using your other hand. Using one hand, push the capped needle against a surface that is firm but not slippery, like a wall. Push until you hear a click. Pushing the capped needle against a wall will make sure the cap is firmly attached. Turn the capped needle in a clockwise direction to unscrew the old capped needle from the pen. Replace with a new capped needle as described in Step 2. Step 4. Selecting the correct dose of Gonal F RFF ReadyJect. Check your treatment diary if you are not sure what dose to use today. If you are unsure about your dose, call your healthcare provider. Turn the dose knob in a clockwise direction until your prescribed dose of Gonal F RFF ReadyJect shows in the dose display. Do not push or pull the dose knob while you turn it. If you pass your dose, turn the dose knob back to the correct dose. Look at the dose display on the pen in bright light, like by a sunlit window or under a lamp. If there is glare on the pen, move the pen so you can clearly see the dose display. The dose display here shows the dose of 150 IU as an example. Your prescribed dose may be different. Step 1. Preparing the pen. Note: your healthcare provider may prescribe a dose of Gonal F RFF ReadyJect that requires you to use 2 pens. If you need to use 2 pens, follow the same instructions for both pens. Take the Gonal F RFF Ready-Ject out of the refrigerator at least 30 minutes before you plan to inject your dose to allow it to warm to room temperature. Allowing the Gonal F RFF Ready-Ject to warm to room temperature before injecting your dose will help make your injection more comfortable. Open the carton by lifting the blue tab to open the top of the box. Look at the pen and make sure you have the correct pen strength of Gonal F RFF Ready-Ject. Along with your pen, you should see needles in the carton. Prepare a clean, flat surface like a table or countertop. Gather all the supplies you need to give a Gonal F RFF Ready-Ject injection. Wash your hands well with soap and water. Dry your hands well. Remove the pen and a new needle from the carton. Set aside the carton with extra needles. You will store the partially used pen in the carton later. Do not shake the pen. Shaking the pen may cause air bubbles to appear in the reservoir. Become familiar with the parts of your pen. The numbers you see in the dose display and the reservoir represent the number of international units, IU, of medicine. Check the expiration date on the pen label. Do not use the pen if the date has expired. Get another pen with the date that is not expired from your healthcare provider or pharmacist. Hold the pen with one hand and pull off the pen cap with your other hand. Put the pen cap aside. You will place it back on the pen later. Check the reservoir in the pen. There should be no cracks in the plastic window, and there should be liquid in the reservoir. The liquid should be clear and colorless with no particles. Get another pen if there are cracks in the reservoir, there is liquid, or the liquid is not clear and colorless. Check the dose display in the pen. If there is any number other than 0 on the dose display, set the dose display to 0. To set the dose display, turn the dose knob in a counterclockwise direction until you see 0. Step 2. Attaching the needle to the pen. Pick up the new needle. Remove the peel-off seal from the outer needle cap. Hold the outer needle cap in one hand and the pen in your other hand. Place the needle on the end of the pen where you see threads. Using some slight pressure, screw the needle onto the pen in a counterclockwise direction until you cannot turn the needle anymore. Gently remove the outer needle cap and place on the table to use later. Leave the blue inner needle shield on the needle. Step 3. Removing large air bubbles from the pen. Small air bubbles in the pen's reservoir do not need to be removed from the pen, but large air bubbles in the pen's reservoir must be removed. A large air bubble is a bubble that appears all the way across the top of the reservoir. If you do not see a large air bubble, go to Step 4 to select the correct dose of Gonal F RFF Ready-Ject. If you see a large air bubble, turn the dose knob in a clockwise direction until the dose display reads 25, meaning 25 IU. Only use 25 IU to remove air bubbles. With the needle pointing up, tap the reservoir with your finger to allow any large air bubbles to rise to the top. Carefully remove the blue inner needle shield and throw it away. Do not recap the needle with the blue inner needle shield. Holding the needle pointing up, slowly press the dose knob as far as it will go. Release the dose knob. Find the outer needle cap and place on a flat surface. Holding the pen in one hand, slip the needle into the outer needle cap without using your other hand. Using one hand, push the capped needle against a surface that is firm but not slippery, like a wall. Push until you hear a click. Pushing the capped needle against a wall will make sure the cap is firmly attached. Turn the capped needle in a clockwise direction to unscrew the old capped needle from the pen. Replace with a new capped needle as described in Step 2. Step 4. Selecting the correct dose of Gonal F RFF Ready-Ject. Check your treatment diary if you are not sure what dose to use today. If you are unsure about your dose, call your healthcare provider.
Turn the dose knob in a clockwise direction until your prescribed dose of Gonal RFF Reproductive shows in the dose display.
Do not push or pull the dose knob while you turn it. If you pass your dose, turn the dose knob back to the correct dose. Look at the dose display on the pen in bright light, like by a sunlit window or under a lamp. If there is glare on the pen, move the pen so you can clearly see the dose display. The dose display here shows the dose of 150 IU as an example. Your prescribed dose may be different.
Step 5. Selecting the injection site and injecting your dose of Gonal RFF Reproductive.
Your healthcare provider should show you the injection sites to use around your stomach area. Your healthcare provider may show you another area of your body to use for your injections if you cannot use your stomach. Use a different site each time you inject yourself to reduce the chance of skin problems such as redness and irritation. Select your injection site and wipe the skin with an alcohol pad as your healthcare provider showed you. Pick up the pen. Make sure the dose on the dose display matches your prescribed dose. If the dose does not match your prescribed dose, adjust to the correct dose. Carefully remove the blue inner needle shield and throw it away. Do not recap the needle with the blue inner needle shield. Hold the pen at a 90-degree angle and push the needle into your skin. Press down on the dose knob with your thumb and hold the dose knob as far as it will go to complete the full injection. Wait at least 5 seconds to make sure you receive your full dose. Carefully remove the needle from your skin and put the pen on the table. Hold a gauze pad firmly on your injection site for a few seconds to make sure the medicine dose does not leak out. Step 6. What to do when your injection is completed. Do not recap the needle with the blue inner needle shield. Recapping a needle can lead to a needle stick injury. Remove the needle from the pen after each injection. Find the outer needle cap and place on a flat surface. Holding the pen in one hand, slip the needle into the outer needle cap without using your other hand. With one hand, push the capped needle against a surface that is firm but not slippery, like a wall. Push until you hear a click. Pushing the capped needle against a wall will make sure the cap is firmly attached. Turn the capped needle in a clockwise direction to unscrew the needle from the pen. Find the pen cap and push directly onto the end of the pen. The pen cap will not fit over a used needle. If there is medicine left in your pen, go to Step 9 for storage information. If there is no medicine left in your pen, go to Step 7 for disposal information. Step 7. Disposal of your used needles and pens. Put your used needles in an FDA-cleared sharps disposal container right away after use. Do not throw away loose needles and pens in your household trash. If you do not have an FDA-cleared sharps disposal container, you may use a household container that is made of a heavy-duty plastic, can be closed with a tight-fitting, puncture-resistant lid, without sharps being able to come out, upright and stable during use, leak-resistant, and properly labeled to warn of hazardous waste inside the container. When your sharps disposal container is almost full, you will need to follow your community guidelines for the right way to dispose of your sharps disposal container. There may be state or local laws about how you should throw away used needles and pens. For more information about safe sharps disposal and for specific information about sharps disposal in the state that you live in, go to the FDA's website. Do not dispose of your used sharps disposal container in your household trash unless your community guidelines permit this. Do not recycle your used sharps disposal container.
Step 8. recording the Gonal F RFF Redyject injection in your treatment diary.
Unfold your treatment diary and fill in each column as indicated. For detailed examples of how to complete your treatment diary, please refer to Step 8 in the detailed Instructions for Use. Step 9. Storing your pen. Before you use your pen for the first time, store your pen in the refrigerator between 36 degrees Fahrenheit to 46 degrees Fahrenheit, 2 degrees Celsius to 8 degrees Celsius until the expiration date, or store your pen at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius for up to 3 months, or until the expiration date, whichever comes first. After you use your pen and there is still medicine left, store your pen in the refrigerator or at room temperature up to 28 days.
Throw away any unused Gonal F RFF Redyject after 28 days. Store your Gonal F RFF Redyject with the pen cap on in a safe place. Store the Gonal F RFF Redyject away from light. Do not freeze Gonal F RFF Redyject. Keep Gonal F RFF Redyject and all medicines out of the reach of children.
Step 6. What to do when your injection is completed. Do not recap the needle with the blue inner needle shield. Recapping a needle can lead to a needle stick injury. Remove the needle from the pen after each injection. Find the outer needle cap and place on a flat surface. Holding the pen in one hand, slip the needle into the outer needle cap without using your other hand. With one hand, push the capped needle against a surface that is firm but not slippery, like a wall. Push until you hear a click. Pushing the capped needle against a wall will make sure the cap is firmly attached. Turn the capped needle in a clockwise direction to unscrew the needle from the pen. Find the pen cap and push directly onto the end of the pen. The pen cap will not fit over a used needle.
Using your thumb, flip the protective plastic cap off the Gonal F multidose vial. Wipe the top of the vial with an alcohol swab. Carefully twist and pull off the rubber cap from the pre-filled syringe of bacteriostatic water. With the vial of Gonal F powder on a flat surface, insert the needle of the pre-filled syringe straight down through the marked center circle of the rubber stopper. Slowly inject the water into the vial by pushing down on the plunger. After all the water has been injected into the vial, remove your finger from the plunger, allowing the plunger to rise to its original position. Withdraw the needle safely and dispose of it in the safety container. Wipe the top of the vial with an alcohol swab. Remove the wrapper from the custom dosing syringe. Carefully loosen and pull the plastic cap from the needle. With the vial of reconstituted Gonal F on a flat surface, insert the needle straight down through the marked center circle of the rubber stopper. Without removing the needle from the vial, Turn it upside down so that the needle points upward. With the needle tip in the liquid, slowly pull back on the plunger until the syringe fills to slightly more than the unit marking that corresponds to your prescribed dose. Keeping the needle in the vial, slowly push the plunger back to your prescribed dose. This will clear away any air bubbles. Carefully remove the syringe from the vial and recap the needle. The custom dosing syringe is now filled with a prescribed dose of Gonal F and is ready for administration.
Your second phase medication is called the trigger shot. This is Novarel, Progesterone, generic HCG, or Ovarian. Up until this point, you've been trying to get your follicles to maturity, which is 18 to 21, but you're there now. So your nurse will give you instructions on the day that you've come in for your blood work and ultrasound. The physician has looked at your scans and determined that you need to take your trigger shot. So your nurse will give you those instructions and review how to do these injections. If you're doing timed intercourse, she'll also tell you what days are the best optimal days for you to have intercourse. If you're doing insemination and you live greater than an hour away, your husband or partner will need to collect his specimen at our offices. If you live less than an hour away, your husband can bring the specimen in provided that you've picked up the appropriate materials. Ovarian is a pre-filled injection. It should remain refrigerated until ready for use. You will take this medication only when you are instructed by your physician or nurse. Allow your injection to come to room temperature prior to injecting your medication, usually about 10 to 15 minutes. Stop your stimulation medications once you take the Ovarian.
With the needle pointing upward, carefully remove the needle cap from the syringe. Remove any bubbles from the syringe by pointing the needle up and tapping on it. Push the plunger carefully until a small drop of liquid begins to appear from the tip of the needle.
The trigger shot. This is your Novarel, Progesterone, generic HCG, and Ovarian. This is your second phase drug. These are all drug names from different manufacturers. This shot triggers ovulation and you'll only get one of them. You'll be instructed on when to take the injection. You'll stop your follistim or other daily injectables. Do not mix or take the trigger shot unless instructed by your doctor or your nurse. The package insert states that this injection must be given intramuscularly. This can be taken subcutaneously. Make sure that you don't test for pregnancy because it will give you a false positive. You may have an area of irritation at the injection site. It can be as big as a wasp sting or burn like a sunburn and be itchy and red. Don't think that you did anything wrong. This is just from the preservatives in the medication.
Using your thumb, flip the protective plastic caps off of the vial of Novarel or HCG and vial of diluent. Wipe the top of the vials with an alcohol swab. Remove the wrapping from the syringe and long reconstitution needle. Twist the reconstitution needle onto the syringe. Carefully pull or twist off the needle cap. Draw air into the syringe by pulling back the plunger to approximately the 1 milliliter 1 cc marking. Place the vial of diluent on a hard, flat surface. Carefully insert the needle through the marked center circle of the rubber stopper into the vial of sterile water. Gently press on the syringe plunger. This will allow the air to enter the vial, which makes withdrawing the solution easier. Without removing the needle, invert the vial and slowly pull back the needle as far as needed to withdraw 1 cc of diluent into the syringe. Make sure the tip of the needle remains in the diluent by slowly backing the needle out of the vial to withdraw the diluent. You will only be using a portion of the diluent. Remove the needle and syringe from the vial. Place the vial containing Novarel or HCG on a hard, flat surface. Insert the needle through the marked center circle of the rubber stopper into the vial. Slowly inject the sterile diluent into the vial of Novarel or HCG by pressing down on the syringe plunger. Without removing the needle from the vial, Gently rotate the vial between your fingers until all of the powder is dissolved. Do not shake. Without removing the needle, invert the vial and slowly pull back on the syringe as far as needed and withdraw the entire contents of the vial into the syringe. Make sure that the tip of the needle remains in the solution by slowly backing it out of the vial to withdraw as much of the solution as possible. Remove the needle and syringe from the vial. Recap the reconstitution needle and remove the needle by twisting it off the syringe. Discard used needle in your safety container. Remove the wrapping from the administration needle. Twist the administration needle onto the syringe. Carefully pull or twist off the protective needle cap. To remove any air bubbles in the syringe, point the needle upward and gently tap on the syringe. When all bubbles have risen to the top, slightly press the plunger until a small drop of solution appears at the tip of the needle. Recap the needle.
Your third phase medication is progesterone. You'll only begin your progesterone when instructed to by a physician. There are 3 products available. There's not one that's any better than the other. It's all based on what you can reasonably afford or if your insurance covers it. The first product is Cronone 8% Vaginal Gel. You'll place this thing first thing in the morning as if you would a tampon. Remove the applicator and go about the rest of your day. The second product is called Endometrin. It's 100 milligram vaginal suppositories. They're small tablets and they come with applicators. You'll remove the applicator as you will with the Cronone and throw the applicator in the trash once the medication has been dispensed. The third one is Progesterone Vaginal Suppositories. These normally don't come with an applicator. You'll have to use your finger and place these vaginally. These are also twice a day. Progesterone supplementation is important because it supports a potential pregnancy until the pregnancy can support itself. There are 3 different types of progesterone supplements, and one type is not better than another. We recommend whatever is most cost effective for you. You will choose one of these products and begin taking it when the physician instructs you to. The first type is Cronone 8% Gel. It's a once daily applicator. It's also the most costly. Coupons are available occasionally online if you prefer this product. The second type is Endometrin. It contains a 100 milligram tablet and it's a twice a day vaginal support. Coupons can also be found occasionally online. Your third type, or your third choice, is compounded progesterone 25 milligram vaginal suppositories. These are twice a day and do not come with an applicator. You'll have to place these with your finger. Insurance may not pay for your compounded medications. We'll review each of these types and the cost in the later slides. Cronone 8% Progesterone Vaginal Supplementation. You're going to keep this medication stored at room temperature. Do not put it in the refrigerator. You're going to take this one time a day in the morning. So it's best to get up, take your medication, and continue throughout the rest of your day. Do not lay back down after placing this. To begin with, you'll remove the applicator from the package. Put the plunger into the end of the applicator. Twist off the top. Place the applicator vaginally as you would a tampon. Depress the plunger, depositing the gel. Remove the applicator. Throw the applicator in your household trash. Typically, the gel stays attached to the vaginal wall to help you absorb your progesterone. It is important that the Cronone comes out during the day. Vaginal irritation and cramping are 2 common complaints with any progesterone product. It is important that you ensure the Cronone has cleared before placing another dose the following day. Cronone costs approximately $18 to $26 per applicator, so it is the most expensive product if your insurance doesn't cover it, but there are coupons available if this is your choice of progesterone. Endometrin 100 milligram vaginal suppositories. Keep your endometrin stored at room temperature. You will not begin endometrin until instructed by your physician or nurse. This medication is to be taken twice daily, morning and evening. You'll have an individual applicator for each tablet. The applicators are single use and disposable. You can lay or stand while placing this product. Endometrium generally costs about $12 to $16 per day for the supplementation. As with all progesterone supplements, you'll want to wear a pad to protect your clothing. Progesterone 25 milligram vaginal suppositories. These are compounded medications. They're available either through your local pharmacy or through your mail order pharmacy. Progesterone vaginal suppositories should be refrigerated. You'll need to place these suppositories twice daily. There's generally no applicator sent with this product, so you may need to lay down while placing the suppository. You'll need to insert the suppository into the vaginal canal with your fingertip. You can continue to lay down once the product has been placed. Just remember, it's okay when the product starts to melt. It's important that you place the progesterone. It's not as important how long it stays in the vaginal canal. You'll need to wear a pad to keep it from getting on your clothing. This product can cost anywhere from $60 to $90 for a 2-week supply. Ovarian hyperstimulation syndrome. This syndrome can happen when you're taking medications to increase the number of follicles that you have on your ovaries. The more follicles that are producing estrogen, the higher likelihood that you are to experience some of these symptoms. Don't panic if you're not having the symptoms, as everyone is different, as well as every stimulation is different. Make sure that you review this part of your booklet regarding this syndrome. This is a comparison of the ovaries in a stimulation cycle. The ovary pictured on the screen is a desired ovarian response for an injectable cycle that will do IUI or timed intercourse. Notice there are 2 lead follicles, meaning that you will have a lower estradiol level. This means that this patient is less likely to experience the signs and symptoms of ovarian hyperstimulation syndrome. This reduces the chances of multiple pregnancies as well. If this were an IVF patient, they would cancel the IVF retrieval and be given the option to switch to IUI or timed intercourse due to a lowered response. Ovarian hyperstimulation syndrome can happen anytime we give you medication to increase the number of follicles that you have in your ovaries. The more follicles you have, such as the one on the screen, the more likely your estradiol level is to be higher. The higher the estradiol, the more likely you are going to experience symptoms of ovarian hyperstimulation. These symptoms can include bloating, nausea, diarrhea, shortness of breath, lower pelvic pain. You also run an increased risk of torsion. This is a twisting of the ovary, cutting off the blood supply. This can also lead to hospitalization to manage your symptoms. If you're an injectable cycle doing IUI or timed intercourse, with this number of follicles, your cycle would be canceled. If you continue and choose to do this cycle, you run an increased risk of having higher order multiple pregnancies, meaning triplets or more. IVF patients may go on to retrieval, and then you would freeze the eggs and transfer them at a later date. Frequently asked questions and drugs used during stimulations and early pregnancy. Exercise, intercourse, nails, and hair treatments are reviewed in this section of your booklet. A chart is located at the back of your booklet to help you determine what drugs are okay to take during stimulations and early pregnancies. A little known fact about CRM is that most of us who work here have been fertility patients at one time or another. This includes some of our physicians, nurses, and administrative staff. Infertility touches all of our lives long before we chose this field. We strive harder for you because we've been on the other side of this medicine and we understand your struggles. We are in your corner and pray for you nightly. Good luck from all of us here at CRM.